inviting and welcoming you all to our 8th-year celebration. This program, Management of Obesity, is brought to you by collaboration with Center for Metabolic Surgery and Doc Plexus together. CMS, that is Center of Metabolic Surgery, is headed by Dr. Raman Goyal and comprises a team of very senior surgeons, physicians, dietitians, physiotherapists, and counselors to help steer patients through the bariatric surgery journey. Now, today we are going to talk about how obesity can significantly impact the bones, joints, and muscles. Obesity contributes to the wear and tear of the joints, eventually leading to osteoarthritis. The additional weight puts pressure on the tendons, leading to tendonitis. Moreover, obesity causes several post-operative complications after knee and hip replacement surgeries. I am very honored to welcome our eminent speaker for the day, Dr. Hemant Bhandari, who is an orthopedic specialist and a proficient joint recovery surgeon based out of Mumbai. He's been working for 32 years now and has amassed a lot of knowledge in his field. Dr. Bhandari, after completing his MBBS in the year 1986 from Grand Medical College and Sir J.J. Hospital, Mumbai, went on to complete his MS Orthopedics from Lokmanya Tilak Medical College, Sion, Mumbai in 1992. He further studied MSc Ortho from the University College London Hospital in United. A member of the Indian Orthopedic Association, Dr. Bhandari practices at the Orthopedic Ophthalmic Physiotherapy Clinic in Bandra West, and he provides services such as orthopedic surgery, physiotherapy, joint replacement, arthroscopy, and trauma surgery. He's a very renowned speaker, participates in a lot of national and international conferences, and has also initiated a lot of academic programs to train young surgeons. Sir, it's an honor to have you here. Requesting you to please start your session.
Thank you very much. Today we are going to talk about obesity and how it affects the bone health. First of all, I'd like to thank Dr. Raman Goyal and Doc Plexus team for inviting me, and it's an honor to participate in this program. Obesity, as we know, is a visible disease. And osteoporosis, often along with that, is a silent disease. Obesity affects in USA more than 68% people. And osteoporosis, I would say every other Indian lady is suffering. The postmenopausal Indian ladies are suffering from osteoporosis. We are in the type of epidemic, but obesity is a silent epidemic which is going around, and it's affecting the population. Apart from obesity problems, Dr. Raman Goyal will talk about, but what I'm in my day-to-day business, I see patients with a lot of bones and joint problems and back pain and other structural issues because of the obesity. Obesity increases the mechanical loads on bone, and along with the mechanical pressure on it, there are also some hormonal changes which take place, and that affect the quality of the bone and the joint function. Often people think that, okay, we are aging, our BMR will go down and, will cause obesity. No, there are other changes which are happening on a cellular level that also can affect the amount of obesity that patient is suffering from. High BMI causes increased BMD. Obesity increases the bone mass, but the poor bone quality and often are prone for fracture. There is a higher fracture risk, especially in obese children, obese women, and men and women having humerus fracture and ankle fracture because of either balance issue or the mechanical issue because of the obesity. In obesity, there is inverse relationship which is happening. Often obese people are suffering from diabetes, and the quality of the bone is affected. There are increased amount of fat cells, and there is increased bone loss. Also, because of the obesity, their level of mobility is less, and that causes decrease in the quality of the bone. How does the weight loss affect the bone health? Sometimes people see they are going up and down on the dieting, and they are trying to lose weight and again putting on the weight. Losing the weight may be good, but along with that, it causes loss in bone mineral density. 10% weight loss can result to 1 to 4% bone mineral density loss. And when the bone mineral density loss happens, the amount of time to recover takes is a very long, and that is directly related to increased fracture risk. People try to cut down on calories to try and reduce weight. I think Dr. Raman will probably talk more about on it. And there are a lot of hormonal changes which happen on the cellular level because of the calorie restriction. How to avoid bone loss with weight reduction? One should ensure that they have an adequate amount of calcium intake and vitamin D intake. Often our vegetarian people are lacking in amount of protein. So we encourage good protein intake, high vitamin D. City dwellers are lacking the vitamin D, and that causes decrease in the mineralization and leading to the poor bone quality. Also, sedentary lifestyle and lack of exercises causes reduction in the bone mass. Maintaining muscle mass, load-bearing exercises is very essential to maintain the strength of the bone. Obesity can increase the possibility of arthritis. And what we see, especially in India, is the knee arthritis is very common, not so much as the hip arthritis. Because of the obesity, the lack of range of movement in the shoulder and hand, it causes rotator cuff issues and grip strength in the hand, and hips and knees wear out much faster. Also, because of the weight, people get midfoot arthritis, flat foot, and corns and strains in the foot and ankle. Also, there are causes of plantar fasciitis and Achilles tendinitis, which happens. What are the treatment measures? Treatment measures, I think Dr. Raman will talk more about the obesity treatments. And what are the specific surgical interventions? Also, he'll talk about. This is what we see typically. Obese person with a very badly deformed knee and causing loss of bone, loss of joint space, arthritis, and even in this case, there is a fracture as well because of the excessive loading on the knee joint. Every pound of body weight places 4 to 6 pounds of pressure on each knee joint. And for overweight patient, each pound of weight loss reduces the load on the knee. So our first aim at the arthritic patient is to try and get the weight down to a controllable level. It is easier said than done, but if they lose some weight of their total weight, their symptoms are much improved. In obese patient, in normal BMI, the incidence is only 3.7%, but a BMI of 35 to 40, incidence of arthritis goes up to 19%. So there is higher chance of arthritis in an obese person. There are some surveys which have said they are 20 times more likely to require a knee replacement because they are unable to manage their activity of daily living. The obesity has a higher complication rate as well. For a TKR, there are higher revision rates of about 7%, whereas in non-obese, it is up to 2%. There are higher thrombosis, superficial, longer surgical time. How do we protect them? Yeah, so we advise them about their weight loss possibilities and offer them the services of dietitian and physiotherapy as well as bariatric surgery. Often we find that if they follow the path, it may be possible that the surgery can be delayed. Also, after the surgery, if they keep their weights down, the longevity of the, say, a knee replacement would be much longer than for a obese patient. Obesity in children also, it affects especially the feet, and it causes flat feet and stretching of plantar fascia, and young people are suffering with pain because of the obesity. Typically around growth spurt time, we find obese children are often subjected to a condition called slipped capital femoral epiphysis, where there is a sudden onset of limp without any trauma, and the growth of the femoral head slips away, causing deformity, and that requires urgent surgery. And often it is missed by general practitioner and local doctors. So that requires urgent attention and urgent treatment as well. And often we see around adolescent time, then slip capital femoral epiphysis can happen. In obese people are higher rate of hip arthritis, and that causes more chances of a hip surgery to be done, and also the surgery also is complicated because of the big mass structure. They have an increased risk of cardiopulmonary risk happening. Often we require special equipment and instrumentation to conduct the surgery, to reach, because hip joint is quite deep inside the body and require a special instrumentation as well. Surgical approaches also need to be planned carefully. Patient's positioning in an obese patient lying on a side or so often can cause pressure sores during the operations or so. Also, we have to adjust their medication according to their needs. Also, obese people are more prone for tendinopathies like a tight IT band and Achilles tendinitis, bursitis, and so their overall mobility is also affected, having slow gait and the ability to do activity of daily living. So our advice is to, for obese people, is to stay fit, lose weight, avoid squatting and sitting cross-legged and climbing chairs so that the knees don't get affected, and follow a strict dietary control. Thank you.
Dr. Unnati?
Often we send patients, those who are, it is easier said than done, that patient go for weight reduction. But often Dr. Raman Goyal has been our savior to save in some of our patients who were helped with bariatric surgery. And then patients have deferred their knee replacement because their symptoms improved after the bariatric surgery. We often find that.
And the results of your knee replacement surgery also improves after their weight loss.
Thank you, Dr.
Yes, it
Hemant.
does,
That was
it does.
a very interesting session and very nice perspective to it. So, sir, will you take some questions now?
Yeah, go ahead.
So my first question for the day is that individuals with obesity participating in fitness activities are usually at a greater risk than patients of normal weight for injuries like fractures in the lower extremities, meniscal tears, or the rotator cuff tendonitis. So what is your observation on this?
It is true because obese people we find often are in middle ages, and because of the long-standing obesity, their joints are also stiff and their range of movements are less. Often they go to say a gym or to a trainer who encourages them beyond their ability, and they often come back with injuries. So they should adapt the fitness regime according to their morphology, according to their ability, and gradually it should be increased rather than trying to overachieve in a very short time. So
Thank you for the
weight
answer.
loss takes a long time, and pardon. Weight loss takes a long time, and it takes a while for them to achieve the weight loss and regain the agility, ability to move their joints, and flexibility as well.
All right, sir. Thank you for that answer. So the next question is, would obesity affect the length of stay and recovery after replacement surgeries?
So sorry, I didn't get that. There was
Yes, sir.
some
I'll just repeat the
connection
question
disturbance.
for
Could you
you.
repeat your question, please?
Sure, sir. Sure. So my question is, sir, that would obesity affect the length of stay and recovery after the replacement surgeries?
It does. Yeah, normally patients with a normal weight are going home in 2-3 days time, but obese people would stay longer in the hospital, anywhere between 5 to 10 days. One is that there is a prolonged recovery time after the surgery. Also, the wounds take longer time to heal, and the ability to mobilize after the surgery is also delayed because of the the weight and their ability to participate in physiotherapy activities.
All right, sir. Thank you so much for that answer. Dr. Raman, do we have anything?
So I think Dr. Bhandari has covered the impact of obesity on bone health in a beautiful manner, saying that it's beyond the mechanical forces, there are hormonal issues involved. And that's what is so important. And, as he was rightly saying, so many times we get patients from orthopedic surgeons because patients are heavy and they will find it difficult to start physiotherapy or adapt to a new knee joint. And most of the time what we have seen is that once the weight loss happens, they accept the knee replacement much more comfortably. So thank you so much, Dr. Bhandari. It had been, we know each other so well for so many years. And I was in Bombay Hospital with you, and later. It's really, orthopedic issues in obesity are so under appreciated. Everybody is talking of diabetes, everybody is talking of PCOS, but the major issues that citizenry feels is the joint pains and bone issues. You see everywhere in the society, the senior people, men and women, limping and walking, and especially those people with obesity. And this could have all been avoided if they had lost weight at right time, and so that the joint damage can be avoided. And we see so many people who are just 40, 45-year-old, and the joints are so worn out that they are suitable candidates for knee replacement. And this kind of issues are happening at an early age because of the obesity in them, significant obesity that is increasing in the population. So I think Dr. Bhandari, excellent talk as usual, and glad that you could spare time for this talk.
Thank you very much, Dr. Raman.
Dr. Bhandari, just a minute. I think we have Dr. Syed Omar as one of our panelists, and I'll ask if he has some questions. Dr. Syed, are you there with us?
Yes, I'm here.
Yeah, hi, sir. Please, do you have any questions for Dr. Hemant?
Yeah, Dr. Hemant, I would like to know which, if you are given a choice, if a patient is given a choice between aerobic and weightlifting exercises for an obese patient, what would you suggest? Or would it be joint aerobics and weight exercises, or what would you suggest?
See, all exercises has to be catered according to the morphology of the patient. His ability to do that exercises has to be assessed. The for weight reduction, you require exercises which will burn your calories to a large extent. But along with that, they simultaneously have problems like joint arthritis, and they're not able to walk. It's a vicious cycle. They can't walk, they gain weight, and because of the weight gain, the arthritis increases. For according to the patient type, our physiotherapist plans the program. Those who are able to do aerobic type of exercises or joint flexibility type of exercise, that is catered along with it. Load bearing exercises, weight training exercises is good for the bones, but for people who are having arthritis and obesity, we often ask them to do heated pool exercises where the weight is taken off and they can mobilize their joint, and plus the body of water gives you the resistance to burn your calories. So those facilities are far and few in between, but non-loading exercises like cycling or swimming, that also is helpful in obese people because they cannot participate into running, jogging, hill climbing, all these activity because they have simultaneously have arthritis problem as well.
Another question, sir. What would you suggest in a diet for increasing the bone mineral density? One, for a normal obese patient trying to reduce his weight. Another for a person who has undergone bariatric surgery. So what would you suggest for increasing the bone mineral density for these type of patients?
Yeah. For bone mineral health, we require higher protein and higher calcium intake. And along with that, adequate vitamin D. Yeah. So those who have undergone bariatric surgery are always usually been assessed by a dietitian, and the bariatric surgeon has already chalked out the program of diet and extra supplements for them. Along with that, when their weight loss has happened, their ability to do the exercises increases. So we then progressively increase their load bearing exercises, and that gives the bone strength. So it is planned according to each patient and catered according to each patient, according to the ability and the whatever there is primary physical activity level, and then keep on increasing as the time progresses.
Thank you, sir.
All right.
All right, sir. Thank you so much for being here again. We cannot thank you enough. And this is our 8th-year celebration. So you being here is even more special. And we look forward to hear from you again, sir. Thank you so much.
Thank you. Thank you. Bye.
Dr. Raman,
Yes.
can we go ahead with your session, sir?
Sure. Thank you. Thank you, Dr.
Thank you so much,
Anuti. So I think with the groundwork already done by Dr. Bhandari talking about the obesity and bone health, let us talk about how a person can lose weight and maintain that lost weight. And I think Dr. Sayed asked a very relevant question about the kind of exercises that should be done. So I think I'll answer that question also. Somewhere in my presentation, I have a brief presentation of just about 5 minutes, and some of these slides I have taken from Dr. Bhandari only. So thank you so much, Dr. Bhandari, for sharing those slides. So I talk on behalf of our Center of Excellence in Bariatric Surgery, which is at Wockhardt Hospital, Mumbai Central. And I'm going to talk primarily on impact of bariatric surgery on joint health or bone health, whatever you want to say. Now, we all know that it is desirable that the person loses weight so that the joint wear tear is less. But the fact remains that the patients who are waiting for an orthopedic operation, if you put them on weight loss attempt with diet and lifestyle changes. So almost all of them try, almost 90% of them try, but majority of them are not able to lose enough weight. And still, those who lose weight, a good number of them are not able to maintain weight. And that's a cycle, because you cannot ask them to exercise much, as Dr. Bhandari said, because of the physical limitation that they face. And then so how do they lose weight and how do they maintain weight? And this ability to walk, climb steps, everything improves within a short duration after bariatric surgery, even without orthopedic surgery. And when orthopedic surgery is done, they practically become a normal person, because they have lost weight and their joints are replaced and they are fully functional. And then what happens on the bones? So after let's say a gastric bypass, the lumbar pain reduces from 62% to 11%. So a very large number of patients with back pain have it because of their obesity. And once that improves, the hip pain reduces almost 80% plus, and knee pain reduces from 57% to 14%. So we tell patients that though the pain has gone, the disease has remained, the joint wear tear is still there. And if they have surgery, when the knee surgery or spine surgery or hip surgery, when they have lost weight, their ability to accept the new joint and ability to accept physiotherapy improves significantly. And this study shows the patients who had knee pain with early osteoarthritis, they had bariatric surgery. Within 3 months, they lost about 6 BMI points, which means about almost about 20 kgs. The joint space increased, and the American Knee Study score improved significantly in these patients. So bariatric surgery helps the patients in improving their movement of the joint because the pain reduces. Now, if this surgery is done before joint replacement, if bariatric surgery is done before joint replacement surgery, it reduces hospital complications in knee surgery. And this is what Dr. Unnati was asking. And there are studies to show that it reduces risk of 3 months or 90 days complications of the knee replacement surgery, though there is no impact on revision surgeries. So that means in long term, it doesn't make a difference, but it definitely gives a safer outcome in the first month and first 3 months after a knee replacement. So to conclude, obesity and bone health are closely interrelated, not only because of the mechanical forces, but also because of hormonal forces. What is important to realize is not only the weight gain, but even weight loss leads to poorer bone health. And that is why when Dr. Syed asked that question about how to maintain bone health, after bariatric surgery, it becomes even more important to monitor these patients, that they should be taking their calcium and vitamin D regularly. And not only that, they should be consuming adequate proteins, because all the three things together and regular exercise helps in maintaining better bone mass. And we insist on patients that they should be doing more weight training or strength training after bariatric surgery, because that improves the bone health. Obesity related results in joint pains, limited mobility, and increased risk of falls, which we know. Obesity results in higher complications of bone surgery, and weight loss helps improve joint pains and joint surgery outcomes. Bariatric surgery can help in significant and sustained weight loss, and weight loss associated impact on bone can be minimized with nutrition, supplement, and exercises after bariatric surgery. So this is important that we talk to the patient that though you are losing weight, to improve your bone health, you need to make extra effort, and that is generally successful, because these patients are closely monitored by our nutritionist, by our physician, and by our counselor to ensure that their bone health remains in good condition. Just digressing from the topic of the day, friends, now bariatric surgery is accepted. In 2013, central government has offered these surgeries to all their employees, central government employees and their dependents, right from 2013 at the government cost. Most large corporates have been paying for their employees for bariatric surgery. And from 1st October 2020, all insurance companies are offering cashless bariatric surgery to all the insured persons. And bariatric surgery, incidentally, is the only obesity treatment modality for which insurance pays. They don't pay you to go to a nutritionist. They don't pay you to go to a gym. But for bariatric surgery, all the expenses are completely covered by insurance companies. So feel free to contact us if you wish, if you have any doubt about bariatric surgery, since this program is seen by family physicians, or about insurance. I'll be very happy to share the guidelines so that you can counsel your patients. So thank you so much for your time, and thanks to Doc Plexus and Dr. Unnati for hosting this program for us. Thank you.
Thank you so much, sir. The pleasure is all ours, and thank you for making it so informative all the time. Sir, so questions. I have a question for you.
Sure.
So, several prospective studies have shown that bariatric surgery is associated not only with an increase in bone turnover markers in favor of an increased resorption, but also with a decrease in bone mineral density. So, how should a surgeon deal with this issue?
Okay. So I mentioned that in the take-home message, Dr. Unnati. So this is the same thing which remains even before surgery in senior citizen. They lose bone mass because they are exercising less, they are not taking enough calcium, or they are not taking enough proteins. After bariatric surgery, because the intake is less, this is even more challenging. But here patient is in a supervised environment. So most of our senior citizens who are at home are in an unsupervised environment. They don't go to an orthopedic surgeon or to a nutritionist or to a bariatric team on a regular basis. While bariatric patients are in a supervised environment where they are followed up, they have to do annual tests for vitamin D, calcium, and their proteins. And thus we have published our results about this, that in majority of the patients, we are able to provide better nutrition than what they were getting before surgery, and they have better overall health after surgery. So I think it's a challenge what you are saying, but it is a challenge not only after bariatric surgery, it's a challenge after any attempt of weight loss. When a person is put on diet, the challenge is the same, or if they are put on a medicine for weight loss, the challenge is the same, that how to keep the bone health in good shape. And what Dr. Bhandari has mentioned, these are the same principles that we follow after bariatric surgery too. Dr. Bhandari, do you want to add anything to that?
No, it is very essential. Bariatric surgery will help to patient to start his journey on weight reduction, but other health matters like bone and joint health, that needs to be looked after, and they need to continue with the exercises so as not to regain the weight loss which they have achieved, and also regain the mobility and the strength of the muscles and the overall physical ability and activity. So it's a lifelong program to remain healthy. Yeah, Dr. Raman can at one point can do the bariatric surgery, but the rest of the journey patient has to carry on through the life.
Absolutely.
So I think there's one more question that has come now, which I think is more related to Dr. Hemant, but either of you can take it. So psoriatic arthritis patients have a higher prevalence of obesity. So what are your observations on this, both of you?
Dr. Bhandari, would you take it?
Yeah, I didn't get it. Psoriatic arthritis. What is the question?
Psoriatic arthritis patients are known to have a higher prevalence of obesity. Sir, what are your inputs on this?
Psoriatic arthritis and obesity, yeah, see, often they are on, steroid usage as well to carry for their skin condition. And prolonged steroid use also can increase the obesity. Yeah, and psoriasis often is associated with arthritic changes, especially in the knee joint and the small joints or so. So there is a connection, but they would be treated, first to try and get their skin condition better. Then only we can do the joint surgeries, because the open festering wounds, they are prone for more infection.
All right. Thank you. That was very well answered. So, Dr.
Thanks.
Syed, do you have any questions for Dr. Raman?
Dr. Raman,
Yes, sir.
mostly when we give supplementation of vitamin D for a normal patient, we tell them take it like 60,000 units once a week for 2 months, then once a month for a year, something. What is the most common dosage that you suggest for a bariatric surgery patient who has undergone bariatric surgery?
Yeah, excellent question. So, Dr. Sayed, we monitor their vitamin D3 very closely, and we try to maintain it around 60 or so. We don't like it around 30, which is the normal value. So I think this is now a more accepted value, that it should be around 60. And so we usually replace it through intramuscular injection. So once it comes around 60, then we maintain the course that you are mentioning, that 60,000 units once a week. And even if it drops to 30, we maintain it with this course. And then they are taking once a month for rest of the life. And annually we check their vitamin D3. And if it again drops below 30, we give intramuscular replacement so as to keep it around 50 to 60 at least. And most of the patients are able to maintain it because they are also being supplemented with calcium citrate, 1000 milligram daily in 2 doses. So this is how it works, yeah, basically.
Thank you, sir.
Dr. Sayed, anything else?
How much does bariatric surgery affect normal digestion of calcium, sir, from a normal diet?
Yeah, so, it's very interesting because calcium absorption happens in proximal jejunum, duodenum and jejunum. And it is seen that any weight loss attempt, it's not only bariatric surgery, even with diet, calcium levels are affected in body. And this is of paramount importance because usually this is overlooked in conservative measures. Now, it is significantly affected after bariatric surgery. So we need to hypersaturate them or supersaturate the calcium level in the gut. And so in men, we usually give about 1000 milligram, and women, we give between 1500 to 2000 milligram a day. And then we don't see calcium deficiencies or vitamin D deficiency. Most of these patients are coming to us even before surgery. Their vitamin D level, 3 days back, we operated a patient. Her vitamin D was 4. So the vitamin D is deficient in the population as such. And thus, it's even more important for our team to make sure that we bring it up to normal level. They may be deficient for last 10 years or 20 years, we don't know. But the real issue is, how do we ensure that post-bariatric they become? So calcium metabolism is calcium, vitamin B12, these two vitamin and mineral are of paramount importance after bariatric surgery to us and to the patient.
So thank you, sir.
Dr. Sayed, I'll briefly speak about your question to Dr. Bhandari about aerobic versus strength training. So what we need to be clear, I've been in obesity for 21 years now. What we need to discuss in the exercise part is, why is exercise being prescribed? If it is being prescribed for cardiorespiratory health, then aerobic is very important. If it is being prescribed for weight loss, immediate weight loss, then aerobic is very important. But if you're looking at long-term bone health or long-term weight loss, then strength training is extremely important. So I think what is happening in obesity, we get mixed up in that obesity also means overall health. It does mean that, but the ultimate aim should be clear in our mind. Are we doing it for weight loss? Are we doing it for overall health? And are we doing it for short-term weight loss, or are we taking long-term weight maintenance? So after bariatric surgery, we tell them that you should be doing more strength training, because I want these people to develop more muscle mass so their bones become stronger. And when they have more muscles always burn more calories than what calories are burned by fat tissue. So if they have more muscles, it is easier to maintain weight in long term than if they are sarcopenic or if they have less muscle. So I think a mixture in a typical non-bariatric patient, a mixture of aerobic and strength training is what is desirable. And as Dr. Bhandari very correctly mentioned, that one should go very gradual. One can take years to reach a level of exercise that is desirable. Because if you, what we see, as Dr. Bhandari mentioned, that somebody goes to gym, they are pushed into exercising, then they get injured, a muscle injury or a bone injury, and then they're out of exercise for 1 month or a few months. The very benefit that should have come to them is lost. So I think exercise, again, an issue which needs to be discussed more in detail between family physicians and patients, because this is something very, very relevant for which patients don't come to an orthopedic surgeon. They typically go to a family physician. And if this thing is clear in their mind, it's very easy to communicate it to the patients.
Sir, but speaking generally, one thing which I would see is we have a lot of youngsters and everybody, a little out of topic, going to gyms and everything. What I would want to know is how long will be the maintaining going to the gym, and what will happen when they stop going to the gym? After getting 40, after hitting 50, what happens to their muscles? What happens to their bone density? What happens to their weight? What happens to their muscle tone? What happens to all of these after they stop going to gym after 30, 40 or 50, whatever? Then what happens?
Yeah, sure. So I'll tell you it should be reverse. Senior citizen should be exercising in a gym on a regular basis than a youngster. I need exercise more than my son, because if I want to avoid osteoporosis, spontaneous fractures and falls, I should have more muscle and more stronger bones at this age than somebody who is 24-year-old, because they are because of their age, they have better muscle mass. What you are saying is little different. What I'm saying is, so these youngsters, if they are exercising, they should continue to exercise, because when they become senior, they need the help of their bones and muscle more than what they needed when they were young. When they were young, they were doing it to look fit and to be smart and to, for various social reasons. But for health reasons, I believe the senior citizen need to exercise more. I think Dr. Bhandari will be in right position to tell about this a little more. Do I need it more than my son, Dr. Bhandari?
So very true, because they have to maintain their bone mass, because in men, the bone mass decreases at rate of 1% a year, and postmenopausal women, the BMD decreases at 2 to 3%. And 5 to 10% ladies are rapid loser. They are losing at rate of 10%. And the bad part of it is that what we see is the ladies coming with hip fractures and spine fractures. Hip fractures in a very elderly group, overall, all over the world, UK, America, Europe, 20 to 40% mortality within 66 months. So it is a terminal event. So they need to maintain their bone strength so as to save themselves. So, and people who are regular, especially after a certain age, two things happen. One is the bone strength improves, also their balance and activity level also improves because of the exercise.
So I think, Dr. Sayed, that was such a relevant question that generated this much excitement, because I am very passionate about this, and I keep telling my patients that, you must go with your son or daughter to gym. And even if they discontinue, you should continue, because you need it more than the youngsters. And I think this is what this program is all about, that we bring out those issues, not talking about big medicines or big surgeries, but we bring about those issues which a family physician can easily counsel a person who is coming to them for hypertension or some other issue and is obese, and that patient can be told very easily by family physician how to remain fit. Dr. Unnati?
Thank you so much, sir. And I really like the way this discussion got shaped with one question. I think this is all that program is about, so that people ask questions and we bring new perspective. Thank you once again. And thank you, Dr. Sayyed. Thank you, Dr. Hemant, for being a part of this
Welcome.
program. So I think we
Thank
have
you.
one more question coming up.
And there's a video of a patient, Dr. Unnati.
Yeah.
Yeah.
So, sir, do you want to take the question?
Yeah, go ahead.
So does childhood obesity contribute to the early development of osteoarthritis in adulthood?
Childhood obesity often can lead to issues which I discussed in the case, like the slip capital femoral epiphysis, genu valgum. And if the morphology of the patient has changed, it puts them at a mechanical disadvantage. Their level of activity decreases and they are prone for early arthritic changes. So the childhood obesity often progresses to adulthood, and that also contributes early arthritic changes and lack of ability to participate in life in a full active manner.
So, very well answered, sir. So, although the second question you have already answered, but I'll just still read it out to you. What lifestyle modifications are advised for obese patients with joint disorders? I know you have covered it, but just to maybe simply
Yeah, to
reiterate it.
recap it again, first of all is that they have to start their journey and understand the implications of being obese. There are physical implications that we see with arthritic joint pain and all that, but what Dr. Raman also has spoken about, the other medical factors about the hypertension, heart issues, and other down complications of obesity. So what we advise them is to first understand that this is a problem, and then to embark on journey to correct it. Initially it's a dietitian, it is a lifestyle modification, then the exercises to lose weight, exercises as per the ability of that person's body to do it, and try and maintain the weight loss. Those who are not able to do it, then we have to refer them to specialized centers for bariatric surgery or endocrinologists as per the needs of the patient. And if over the period of time the joints get affected, yes, we do the treatment for it in means of injections.
I think there
Hi,
is.
sir, are you there?
I think the internet is.
I think we got a little bit of it. So, I think very well answered, Dr. Raman.
Yeah, I think Dr. Sayed wants to ask a question.
Yeah,
Operations.
Dr. Raman, again for you, sorry for pulling this so long.
No
Do you
problem.
think a person who has gone bariatric surgery, a patient who has gone bariatric surgery, if in their early lives, could they become bodybuilders? Could they also achieve a physique? Do you think it's possible with bariatric surgery?
I'll show you pictures of my patients. You can't even believe they have some of them who are regularly exercising have bulging muscles, and they are marathon runners. So there is no reason why this question should be asked, because the nutrition quality and significantly improves. Just because the person is not able to eat 6 chapatis a meal doesn't mean that his nutrition will be affected. Rather, the nutrition is going a much healthier way, with just 1.5 2 chapatis, enough proteins, enough vitamins. So certainly, Dr. Sayed, this is not an issue. But so many of our patients, because these people have gone through very difficult times in their lives. They can't even walk. They can't go to a restaurant because they're ridiculed. They don't get married. They don't get job. If they get a job, they don't get promoted. So they have such phenomenal amount of motivation within themselves that they are the ones who are able to go to a gym on a regular basis, and they want to prove the whole world wrong that they can be healthy. So I think there is no reason to doubt that they cannot. I mean, definitely they can become bodybuilders.
So thank you.
Thank you so much, Dr. Sayed. You certainly are very enthusiastic and really appreciate about you. So I don't think we have any more questions, Dr. Raman. So let's move on to the patient's part.
Yeah.
Okay. Can we have the patient's part, please?
Good evening. I am Santosh Gupta here. मेरा सर्जरी 2013 में हुआ था. I was एकदम मतलब मेरा बॉडी कुछ रिस्पॉन्स नहीं करता था. मैं बेड पे से उतरना नहीं चाहती थी और एकदम डिप्रेस हो गई थी. वेट भी 118 हो गया था. कि सब लोग मेरे को बोले कि सर्जरी करा लो, अच्छा हो जाएगा आंटी. डॉक्टर ये बिनियाला मेरे लड़के का फ्रेंड है. उसने बोला आंटी आपको 20 साल और जीना है अभी. नहीं, मेरे को नहीं जीना है ऐसी लाइफ में. तो प्लीज आप अगर ऐसा, तो बोले नहीं आपको 20 साल ही रहेंगे हम, और सर्जरी करा के आपका वेट कम करेंगे. ऐसा कुछ होता है तो करो. फिर मैं देखो तैयार. इस सर्जरी के बाद मुझे बहुत अच्छा लगा. आई एम वेरी हैप्पी. अभी मैं कॉन्फिडेंस भी बहुत बढ़ गया मेरा. और शुगर लेवल मतलब आ गया था उस पे लास्ट पे, वो भी मतलब खत्म हो गया. शुगर भी नहीं है अभी जैसा. और मैंने मतलब 58 मेरा 58 का एज हुआ तो मैंने स्विमिंग सीखा. मेरा वेट कम होने के बाद 35 केजी कम हुआ तो मुझे स्विमिंग सीखने का मन. मैंने कोच को बोला मुझे स्विमिंग सिखाओगे क्या? बोले हाँ जरूर, क्यों नहीं आंटी, सीखो. तो मैंने स्विमिंग भी सीखा और उसके बाद मैं काफी हैप्पी हूँ. ये वेट मतलब ये सर्जरी के बाद बहुत अच्छा लगा मुझे. और अभी काफी मैं एंजॉय करती हूँ मेरी लाइफ. कहीं भी चढ़ सकती हूँ, उतर सकती हूँ. थोड़ा बहुत चीटिंग करती हूँ खाने में जरूर बस, लेकिन वैसे बहुत अच्छा है. कोरोना का 2 साल भी बहुत अच्छा गया, सब अच्छा हो गया. बस मेरे को अभी इतना वेट रह के भी मैं खुश हूँ.
मिसेस गुप्ता, आपका ऑपरेशन के पहले क्या हेल्थ प्रॉब्लम्स थी? वजन के अलावा
मतलब एकदम डिप्रेस हो गई थी. वेट ज्यादा होने से मेरे को चलने फिरने में तकलीफ होती थी. और मुझे जैसा कि लगता था कि क्या लाइफ है, बेकार है, नहीं जीने का है, मुझे खत्म करो, मेरे को नहीं चाहिए. कुछ भी मतलब मेरे को मेडिसिन वगैरह लेने की इच्छा नहीं होती थी, कुछ भी नहीं होती थी. तो फिर बाद में सर्जरी के बाद बहुत अच्छा लगने लगा मुझे. शुगर भी नहीं है, सब एकदम अच्छा है.
तो आपको
मैं 4 साल की यात्रा भी जाके आई है सर्जरी के बाद, वहां भी कोई प्रॉब्लम नहीं आया मुझे.
तो आपको पहले क्या जॉइंट पेन्स होते थे? आप चलने में क्या प्रॉब्लम थी?
तो पैर में मतलब बॉडी पूरी हैवी लगती थी और ऐसा पेन्स तो रहता ही था. तो थोड़ा वो तो पेन्स होता ही था. और वैसे मतलब वेट के कारण मैं बहुत परेशान हो गई थी. जॉइंट्स में भी फर्क आया, पेन में फर्क आया.
को बेरियाट्रिक मतलब आपको ये सर्जरी करवानी है, इसके लिए आपको मतलब कैसे ख्याल आया, किस तरह से आप डॉक्टर के पास गए?
मैं मेरे फैमिली डॉक्टर के पास गई थी, राजेश बिनियाला के पास. मेरे फ्रेंड्स के डॉक्टर है वो. तो मैंने बोली राजेश मुझे अभी नहीं जीना है, बस खत्म. मुझे बहुत इतनी तकलीफ होती है, मुझे नहीं जीना है. बोले नहीं आंटी हम आपको 20 साल और जिलाएंगे, आपकी ये सर्जरी करेंगे हम. बोले ऐसे कुछ हो सकता है मिरेकल, तो मैं जरूर कराने को तैयार हूँ. तो फिर मतलब ये सजेशन लिए 8 दिन के अंदर सब तेरा टेस्टिंग वेस्टिंग करके डॉक्टर गोयल के साथ बात मीटिंग हुई, फिर उन्होंने मतलब मेरी सर्जरी की, बहुत अच्छे से सब मेरा अच्छा हो गया और 35 के ऊपर केजी मेरा लॉस हुआ।
अच्छा, ओके,
हाँ।
बहुत अच्छी बात है ये तो। मतलब हम बहुत खुश हैं कि अब आप पहले से बेहतर है, क्योंकि मुझे ऐसा
या-
पता चला है कि
हैप्पी। अब ऐसा मुझे लगता है ये भी करो वो भी करो, ऐसे
जी
मुझे
जी जी
हाँ
जी,
सुनी
बहुत
जाके
बहुत अच्छी बात है जी। बहुत खुशी हुई जान के, क्योंकि ऐसा डॉक्टर रमन ने बताया कि आप सर्जरी के पहले काफी हद तक बेड पे आ गए थे, बेड रेस्ट पे, और अब आप काफी एक्टिव मुझे अभी भी दिख रहे हैं।
अभी मैं
तो
स्टेयरकेस भी चढ़ जाती हूँ, 2-2
वाओ,
दिन चढ़ जाती हूँ। अभी
वेरी
कुछ
नाइस,
हाँ
वेरी नाइस, वेरी नाइस। तो सर्जरी के बाद इमीडिएटली आपको अपने रूटीन में, अपनी रोजमर्रा की जिंदगी में क्या चेंजेस करने पड़े थे संतोष जी?
मतलब थोड़ा मतलब खाने में 2-3 महीना थोड़ा मुझे दिक्कत हुआ, बाद में फिर जैसा धीरे धीरे आदत पड़ गई, प्रोटीन्स वगैरह लगातार करते थे और वेट कम हुआ तो अच्छा भी लगता था, जैसे बहुत अच्छा लगता था। हाँ
ओके, और आप अभी भी मतलब वो सारा जो भी प्रिकॉशंस हैं जो आप सर्जरी के पहले मतलब बाद तुरंत बाद लेते थे, आप अभी भी वो सब प्रिकॉशंस ले रहे हैं?
मतलब 70-80% होता है मेरा ऐसा, ये ज्यादा
हाँ
अभी
जी।
थोड़ा बहुत खाया भी जाता है वैसे,
अच्छा, अच्छा, ओके, ठीक
100%
है।
नहीं है। हाँ
और हमारे जो व्यूअर, जो हमारे डॉक्टर साहब हैं, काफी सारे जो ये प्रोग्राम देख रहे हैं, उनसे आप कुछ कहना चाहते हैं आपके जर्नी के बारे में?
नहीं, बहुत से अब तक जैसे सर्जरी कराने के लिए डरते हैं, लेकिन मैं तो जो बोलती हूँ नहीं कराओ, उसमें कोई तकलीफ नहीं है। अपना अच्छा अपनी लाइफ बहुत अच्छी हो जाती है, अपन और एंजॉय करते हैं लाइफ में, कॉन्फिडेंस बढ़ता है बहुत। मतलब मुझे तो बहुत अच्छा लगा, और मैं इससे कोई बात करता तो मैं यही बोलती हूँ, नहीं करा लो, अच्छा है।
ओके, ओके, आई थिंक संतोष जी, बहुत अच्छा लगा आपसे बात करके। थैंक यू कि आप हमारे प्रोग्राम पे आके और अपनी जर्नी शेयर कर रहे हैं। आपको पता नहीं है कि आपकी बातें सुन के काफी सारे डॉक्टर्स और इंस्पायर होंगे, और वो बदले में अपने पेशेंट्स को बहुत काउंसलिंग करेंगे, तो आप इनडायरेक्टली काफी लोगों की मदद कर रहे हैं। तो थैंक यू यहाँ पे आने के लिए, थैंक यू फॉर द टाइम।
श्योर
डॉक्टर रमन, डू यू हैव समथिंग सर?
या आई थिंक मिसेस गुप्ता को तो मैं पर्सनली बहुत अच्छी तरह जानता हूँ,
बस मैं
और
वहां आ नहीं सकती हूँ ऐसे चल।
हाँ, तो और इन्होंने शी हैज बीन अ वेरी पॉजिटिव पर्सन। इन्होंने हमेशा इतना पॉजिटिवली लिया इस सर्जरी को और उसके बाद रिजल्ट्स को, और सिंगल हैंडेडली इन्होंने पूरे फैमिली को भी सपोर्ट किया है अपने, और काफी फिजिकली एक्टिव हो गई हैं और मेंटली भी एकदम अलर्ट हैं। तो मेरे हिसाब से
आपके उससे सर सब अच्छा हुआ मेरा तो लाइफ।
नहीं, वो बात ठीक है, पर आपने जो अपना कंट्रीब्यूशन दिया है और उसकी वजह से इतना ये यही क्वालिटी ऑफ लाइफ का मेन इशू है कि हाउ द क्वालिटी ऑफ लाइफ हैज चेंज्ड
या
फॉर जिन लोगों को एकदम बेड रिडन या ज्यादा लिथार्जी आ जाती है ओबेसिटी के साथ, और वो सर्जरी के बाद वेट लॉस के बाद क्या ट्रांसफॉर्मेशन होता है। सो आई थिंक मिसेस गुप्ता, थैंक यू सो मच फॉर शेयरिंग दिस। आई नो फेस्टिवल टाइम्स में ये बहुत मुश्किल है टाइम निकालना, पर आप
नहीं
हमेशा सपोर्ट करती हैं प्रोग्राम को, और थैंक यू सो मच।
थैंक यू
नमस्कार।
सो मच मिसेस गुप्ता, बहुत अच्छा लगा आपसे बात करके। कंटिन्यू करिए, अपना केयर करिए अच्छे से। हैव अ हेल्दी लाइफ। थैंक यू सो मच।
गुड इवनिंग, आई एम संतोष गुप्ता हियर। मेरा सर्जरी
Do we still have Dr. Hemant?
Yes.
Dr. Hemant, do you have something to say about our patient or her journey? Something you would like to add?
Yeah, it was an excellent talk by this patient, and it seems to have changed her life. And I have my personal experience. I'll narrate a story of my friend, yeah, who came from Middle East. My school friend came from Middle East saying that I'm coming and you do my knee replacement surgery. I haven't seen him after school for 30 years. When he came, he was 140 kg. I said, at this age and this weight, how am I going to do your surgery? So I sent him to Raman Goel. He and his family, within a matter of days, got the obesity surgery done. And, he says my pain is gone. I don't need a knee surgery now. So he's a very happy patient and happy family together. So I've seen some good transformation. We can save a patient undergoing complicated surgery and possibly which can be avoided by such lifestyle changes. So it is a good consideration. Those who are very bad off and the joints are completely worn out, yes, we do knee replacement surgery, but our aim always should be to try and get patient healthy and avoid them from surgeries which can be have a, because in a obese person, if you do a knee replacement surgery which is going to last you 15-20 years, we are looking at another sets of revisions and all that. So if it can be avoided or delayed, all the better.
Thank you so much, sir. That was so nice of you to share that story with us. I think it only adds more relevance and more value to our session today. Thank you so much, and thank you so much for being here, sir.
Thank you.
I know your schedule is very busy, but we still look forward to hear from you again. Thank you for the time.
Thank you very much. Okay.
Guys, have a nice day.
Yeah. Bye.
Thank you, Dr. Raman. Thank you so much for being here. Thank you so much for hosting this program, giving us an opportunity.
Dr. Nati, before you sign off,
yes.
So I'll tell you, Doctor, majority of our patients that we get from consultants are from orthopedic surgeons. And this speaks very highly about their professionalism, that though some of the patients may not need a knee replacement in immediate future, but they are overall looking at the patient's well-being and referring them because they know that this is the right way to go. And Dr. Bhandari and many other orthopedic surgeons in the city have been doing this on a regular basis. And it's a great benefit to the patient. As far as Mrs. Gupta is concerned, she mentioned that in passing, that the person who was not willing to get down from the bed, she went and did a Char Dham Yatra about 1.5 years after bariatric surgery, and she said she never required any support. She did not require any that horse or anything to walk or climb, and she did it on her own feet. So I think it's very important to realize that the patients, it's not only their joint pains, but overall quality of life gets transformed. So before we sign off this today, that happy Diwali to all of you and all the viewers today, because we'll be next Thursday's Diwali and we will not be having a program, but I'm sure we will be continuing after that. Thank you, Dr. Bhandari, for sparing your time, and thanks to Mrs. Gupta and Dr. Sayed. You have such intelligent questions each time. Thank you for being there always.
Thank you, sir.
Thank you, everybody.
Thank you, everyone, sir. Or to all our viewers, thank you so much for being a part of the session. Happy Diwali, happy festivities, and we will see you for the next session after Diwali. Till then, please stay safe, stay connected. Happy doctor. Thank you, everyone.
Bye.
Bye, everyone.